Annual enrollment period is coming up in October. We're setting in September. Over the next few weeks, most of you guys are going to start receiving communication from your Medicare health plan. And sadly, some people across the nation this year are going to experience some catastrophic news. There's actually health plans that are being extracted out of the market this year with certain carriers. You may have a Medicare Advantage plan, there may be a prescription drug plan, there may be some changes that you're going to see, and you're going to get some communication from your carrier letting you know that plan that you're on is no longer going to be available in your market. The plan that you've been using maybe for the last 2 or 3 years or 5 years, 7 or 8 or 9 or 10 years is going to be gone. And some of you guys, like I would be very frustrated and then asking the question like, what do I do next? And here in just a moment, I'm going to cover exactly what you need to do in simple steps and make life easy by making Medicare simple for you. We'll be back in just a second and I'll guide you through the steps. So let's talk about what happens to you in September and in the end of September when you get notification that your Medicare health plan is going to be taken off the market. Typically, for you guys that are on Medicare Advantage plans, every fall in October through December, they benchmark this time frame. You see tons of advertisement. You hear tons of communication about annual enrollment period. During the annual enrollment period, you basically have the option to go from one Medicare Advantage plan to a different Medicare Advantage plan as many times as you want. And the last plan you choose at the strike of midnight on December 7th is actually the plan that will go into effect January 1st. So you can actually make 20 plan changes during that time period. Now, would I encourage you to do that? No. If you're talking to somebody that's a professional expert and a licensed agent, they should be able to provide you guidance to be able to make one plan change if you need to into a new Medicare Advantage plan and then stay on that plan effective January 1st. But Medicare gives you the option to change your plan as many times as you want and create as much confusion as you want. Well, sadly to say, what's getting ready to happen across the U.S. is there's going to be health plans that are going to be taken off the market completely. So the plan that you have or the card that you have in your back pocket, you're going to get notification from your health plan and it's going to let you know that that plan no longer is going to be available in your market. Now, what does that do? That creates confusion and it creates frustration. And I'm going to go over just 2 simple steps that you can take to be able to eliminate the frustration, simplify your life, make your life easy by making Medicare simple. You know, my name is Kelby Hightower with Medicare Hub, and our agency, our real overarching mantra is all about making life simple for Medicare beneficiaries by making Medicare simple for them. And there's 2 things you can do. One, you can stress, freak out, and worry about what do I do next. And typically when we're in a moment of fear, there's 3 things people do. They either fight, they have flight, or they freeze. You know, there's the 3 F's in life, you know, and it's how you respond to things when it's happening to you. We have a sense of fear and we either fight back, we either flee, or we freeze, we do nothing. And just depending on what type of person you are, if you fight back, you may get frustrated, call a carrier, you know, you may yell, scream, and guess what? It's not going to change what's going to happen with that health plan. You might do what I call, you know, fleeing the situation. You may just want to ignore it as if it's not going to happen. And guess what? Come January of next year, if you go into your doctor with a plan that's been taken off the market and you pull your card out and show it to them, they're going to say, yeah, sorry that we don't take that plan anymore. It's been extracted from the market. What's going to happen is actually you're going to go back to original Medicare and be subject to deductibles and co-insurance and cost out of pocket that you typically aren't used to on your Medicare Advantage plan. Or the third thing is, you know, you just freeze. You're like, I don't know what to do, even though you're staring at the gorilla in the room, you're trying to figure out what to do and you just freeze. And I'm going to give you a simple solution to eliminate all 3 of our reactions to fear. You know, those reactions again are we fight, we yell, we get frustrated, we attack, we flee or flight, we just run away from it, or we freeze, we do nothing. Really the second option is the best option. That is picking the phone up, calling either if you have a licensed advisor that guides you through your Medicare health plans every year and answers all your questions, and you have somebody to be able to call in that provides customer service, that holds your hand and renders service and care of quality that you like, call that licensed agent to allow them to help you, guide you towards another Medicare health plan. Or if you don't have that and you're enrolled in your plan, you don't even remember, you've never been contacted by your agent ever since, I would encourage you guys to be able to pick the phone up and give us a call, allow us to be able to connect you to a licensed guide, and that person's going to collect some information, go over an overview with you, and then they're going to walk you and guide you toward the plan that's the best fit for you. Now here's the best news of all. Some of you guys have had some complications with your health, and when the health plan is taken off the market, you actually have the opportunity to either enroll back into a Medicare Advantage plan that's available in your market, but you also have a special election period that allows you to enroll with a guaranteed issue into a Medicare supplement plan. So a supplement is where you pay a premium and it picks 100% up of everything, minus typically a small deductible amount for like a Plan G if you're choosing, depending on what your age is. So some of you guys that had ended up in a Medicare Advantage plan, you were on a Medicare supplement and then you couldn't go back to the supplement because of health conditions, maybe a heart attack, a hospital stay, or whatever that situation was. You called an 800 number, somebody enrolled you into a Medicare Advantage plan. Now all of a sudden you're stuck in this plan and you'd like to go back to a Medicare supplement. Well, guess what? This is an opportunity to allow us to be able to guide you back into that Medicare supplement of your choice and be able to rate shop and figure out what's going to cost you the least amount of money to get you back onto a supplement that covers almost 100% or 100% of everything that original Medicare doesn't cover. So you've got two options there. You can call who you've been dealing with. You can either call us or we can guide you through. But I would encourage you guys not to do the 3 F's. Not fight about it, not flee from the situation, and not just freeze. All 3 of those really are not solving the problem that you're facing, and we would love to make your life easy by making Medicare simple. Here in just a second, we're going to pop our contact information up. If you guys have questions and need some guidance or don't understand what's happening when you do get this letter and let you know your plan is leaving, extracting the market, give us a call. We'd love to provide the guidance and answers those questions. Talk to you soon.